Hello, future nerds, and welcome back to our channel. Welcome back to this video lecture series. In this next disease, actually, this is a video lecture series for still for communicable diseases and infectious diseases. And the next disease that we are going to present is a common childhood infectious disease. Maybe some of you have experienced this during your elementary days, and maybe some did not. And I know some of you will be remembering your experience with the presentation of this disease. I'm talking about mumps, okay, or epidemic parotitis, or beke in Filipino or in Tagalog, okay, and Mumps is an infectious disease, otherwise known as infectious parotitis, and this is a acute viral disease that is usually manifesting swelling on one or both parotid glands, and usually glandular structures are also affected, and I will be mentioning some complications of this disease later, and those are the considered glandular ones, which also has a at risk cases to bring later in life. Okay, so this is caused by a paramyxo virus group, and the mode of transmission is droplet, and the incubation period is 14 to 25 days, or in another reference is 12 to 16 days with average of 18 days, and the period of communicability is 6 days before and 9 days after the swelling. Okay, so before the appearance of the swelling, um, you are already communicable. I am emphasizing that because sometimes you do not know that you have already the mumps virus, and you may already transmit it without knowing that you have the mumps. Okay, especially if your first signs and symptoms is a fever, which is a general manifestation, and maybe the least that you would think that you have is mumps. Okay, so this is an example of an image with mumps, and this is a microscopic view of the virus. Okay, so there's no special diagnostic procedure for mumps, not even culture nowadays, but it's more of clinical picture, what the patient may manifest, may present as signs and symptoms. That's the very least as basis for diagnosing infectious parotitis. And these are other manifestations: sudden headache, earache, loss of appetite, fever is general, swelling of parotid glands, maybe one or two glands are affected. Okay. Pain of usually 2 to 10 days, especially on the collar region, especially on the swelling sites or site. Elevated temperature, still a fever. Then one gland is usually affected first. And nursing care is usually supportive. It's the treatment is usually supportive, meaning it has no specific drug of choice. Nursing care includes placing the patient on complete bed rest until the swelling has subsided. This is to prevent glandular complications, especially to other glands of the body aside from the parotid glands. Wear fitted supporter to prevent pooling gravity in testes, and hold blood vessels away from the testes, especially if the of course the patient is male and they are prone to orchitis or inflammation of the testes. Okay, and the diet is a soft, bland one. Ice cup on collar over the parotid gland to relieve pain. And once you had experienced mumps before, you have a permanent immunity. Especially it's higher if both glands were infected. And then always remember that it's still communicable until swelling subsides. Okay. So I was mentioning earlier some other parts to be affected. Okay, just like for males, testes can be affected. Then fallopian tubes, ovaries can be affected also for females. And the one of the complications of this later in life, there is a chance that a patient can become sterile. Okay, because of these complications. Okay, that's why we have to prevent occurrence of complications. Then mastitis also, CNS involvement, so it reaches the brain. Then nuchal rigidity, deafness, encephalitis, and pancreatitis. Although encephalitis is has higher what's this incidence in children, it's rare. Okay, it's rare in occurrence. So preventive measure, as we all know, there is a vaccine for mumps, which is under the MMR vaccine or the measles, mumps, rubella vaccine, proper disposal of nasopharyngeal secretions, proper covering of mouth and nose when coughing and sneezing, and also just to emphasize, complications in pediatrics or in children is encephalitis, although it is rare. Okay, based from one reference. Okay, so that's all about moms. Okay, so I hope you learned something. It adds up in your review and your refresher, and maybe it brought a memory from your experience. And again, I pray for you to become successful healthcare providers in the future. Just continue studying, just continue to persevere, to be patient, to have deeper faith in our Lord. Okay, so this is your email, sure one, your online nursing educator. Thank you for watching, for listening, for subscribing and sharing. Thank you. God bless.